Welcome to the Onco-PT podcast, where you'll learn from oncology experts, practitioners, and patients to help you on your journey to become a confident and competent Onco-PT. Here's your host, Elise Cantu.
Hey Onco-PT, and welcome to this episode of the Onco-PT podcast. We are continuing our APTA CSM 2025 preview sessions with a fantastic conversation that frankly is long overdue, I think, within oncology. But what we're talking about here is not just within oncology, and I think that's what makes this really unique and part of why this conversation is so overdue. So before I give away their entire presentation, let's welcome Dr. Katie Schmitt and Dr. Paula Stout to the Onco-PT podcast. Now I'm going to have each of the speakers introduce themselves, starting with Katie, please.
Hey, everybody. I am Dr. Katie Schmitt. I am the physical therapist over at Hollings Cancer Center in Charleston, South Carolina, which is part of the Medical University of South Carolina. If you have listened to the Onco-PT podcast before, you probably heard me talk a lot about neuropathy, but I'm so excited to be here with Paula Stout today to talk about breast cancer.
Amazing. And Paula, I'll turn it over to you.
All right, I'm Dr. Paula Stout, and I am in Northwest Indiana, Chicagoland, and work for a large healthcare system. But I'm so excited about what Katie and I have put together. And so I just can't wait to talk about this today. And like you said, that combining the Onco Ortho, because that's what that's what we know we need to do. So thank you for having us.
Oh my gosh, I'm so excited to dive into this. So let's, first of all, your session is actually not under the oncology section whatsoever. So if you are looking for this in real time, either on the app or on the website for CSM, this is actually under the ortho section. So it's ortho, so OR 21188. My patient with breast cancer is your patient with shoulder dysfunction, combining Onco and Ortho-PT. So can you tell us a little bit about this session and maybe a little bit on why this is not in the oncology section programming?
Sure. I guess I can start and Paula jump in for sure. So we first started talking about this in 2023. I met Paula when I was doing CSM 2023. And we started talking about how important it is that a patient with breast cancer is essentially a shoulder patient. And that's so important because of things like the prospective surveillance model and the NAPBC guidelines and just how much other therapists are going to see patients with breast cancer. And I know for me personally, I work in a clinic where I'm the only PT, and we have one other PT who specializes in breast cancer in a different office the next town over. But we're pushing for all these, let's see our patients before axillary lymph node dissections, and those visits cannot all be seen by me. So they end up being seen by our orthotherapists. And our orthotherapists may not know about axillary web syndrome or enough about lymphedema. And so that kind of started to spur our conversation and sort of was the jumping off point. And we thought it was so important for orthopedics to accept this section because we really wanted to bring this to them so that it's more tangible and much easier and less scary when you see a patient with breast cancer and you would know what to look at. Paula, am I missing anything?
No, I think that's wonderful. And I am so glad that this is the question you asked first, Elise, because Katie and I, like she said, we met a couple years ago and we began discussing this. And I'm not even exactly sure how we, did this after your CIPN session, but we got so deep into conversation, and I think it's probably because we're just both so passionate about oncology rehab, and we both had this idea like, hey, let's do this. Let's talk about how our patient with cancer is an orthopedic patient, a neurological patient, I'm saying that all of these other side effects. And so I still have the little handwritten note from when we met after that, Katie, when we were going to do this session. And we were like, okay, we're going to plan for 2025 because we had a phone call after CSM of, I guess it was 23, you said, Katie, right? And because like you said, we realize that all individuals who undergo surgery for breast cancer, any oncology, but especially this, we're talking about breast cancer here, whether it's mastectomy, lumpectomy, sentinel node biopsy, axillary node biopsy, they're all going to have shoulder dysfunction, upper quadrant dysfunction. And so we can help to mitigate and or eliminate a lot of these things. And again, working with other, therapists, and just to kind of help raise this awareness in the entire healthcare field. So I'm excited that this is within the ortho section, you know what I mean, to bring all that in.
And I know, especially as a student and then a new professional, the way that I combed through the CSM programming, because my first CSM was in 2016 Anaheim, and we actually got a printout of the schedule for every day. And I mean, it was like I don't even know the size of paper we had, but it like folded over 3 times, and you pulled it out and it was all the different sections. And then you turn it over to the other side and it was all the other sections, all the programming. And it's overwhelming. Now it's on an app, it's electronic, it's a little less paper, but it's still overwhelming. And so a quick way for someone who is maybe not sure where they want to go or overwhelmed by all the content is to go to a section, go to an academy's programming and say, what am I going to go to here? And I love, as great as that strategy is, because it kind of cuts down on the mental chaos, it also kind of silos us. And that's one of the things that I think is a conversation that's been going on for a while on, because of the way CSM is structured, we tend to silo ourselves. All the oncology programming, all the stuff about cancer, it's in the oncology section, which is great. It has a home there, but it also means that maybe we don't reach as many clinicians who are seeing these patients in their practice. And again, I love that example, Katie, you gave at the beginning of, as much as we're pushing for patients to get into, for prehab or what have you, they can't all see you. You are one clinician. You have a finite amount of time on your schedule. We need clinicians. We need our ortho, colleagues and our neuro colleagues to be able to start seeing these patients, at least in the meantime. Maybe it's not for the entire plan of care, but at least to get started seeing them. Now, there's a lot that happens from when you have an idea, I imagine, on this presentation to the actuality. So how did you really kind of decide on this needs to be in ortho? Here's how we're going to make it work in ortho. Because I'm so pleasantly surprised that ortho accepted an oncology program like this.
I think there was never any really thought about it. It was always, we're just going to go after the ortho folks.
Let's go.
I know. And I think it's a big deal because, as we always say, if you are a physical therapist, you're going at some point and you're going to treat individuals who have a diagnosis of cancer or have had a diagnosis of cancer. So I think it's just so amazing that, like you said, that crossover and that recognition that, that it encompasses so many things.
I think one of the things, Paula, that you've talked about when we've been planning this so much so is that now cancer is more of a chronic condition. And so this becomes a comorbidity that so many folks are going to see. And if it's really, I think it's like 1 in 3 are going to show up with some type of cancer. So we need to really make it less scary and more out there and kind of tie in rotator cuff issues to axillary web syndrome and a pec with an expander underneath it.
Absolutely.
I love that. I love what you just said, because like it is, we know that cancer is now a chronic disease. It's not, because we have earlier detection, better treatments. So we're going to have, individuals living with these side effects. And so to be able to identify that and treat it and again, help to eliminate a lot of it, because, what I say, oncology rehab should be involved from time of diagnosis throughout survival, at every point, like you said, the prehab, Elise,
Agreed.
And then, right after surgery and those sorts of things. So I think that's such a good point, Katie.
Yeah. Now, why at CSM? Like, you could present this at some other conference or something else like that. Why Or, what was the inspiration or motivation behind presenting this really important topic at CSM?
Because it's the biggest platform there is.
That's acceptable. That's absolutely an acceptable answer.
I was going to say, and you don't know about Katie and I, we may present this elsewhere as well, but I agree. And we can reach so many, like you said, it's such a big, but when you look at it, it's overwhelming when you see all of the different offerings and that sort of thing. And it's like, which one do I go to? However, individuals, there's so many people there. And so they can, I just feel like we can reach more people. Yeah. Like Katie said.
Absolutely.
And I think too, with the on-demand option, like now that there's that extra virtual stuff, if you can't, like, if you're like, oh, I really want to go see this thing. I can't see this one today, but you can see it a week later or 3 months later. So that makes it more special too.
Yeah.
And we
absolutely.
are doing
And again,
that.
going back to what Paula said, yeah, increasing that reach. So that's a good question. I'm glad we brought that up. So it sounds like, yes, your session is going to be on demand, which I love. No matter, if attendees are going live in person to the conference or whether they're going to be choosing that virtual option, why do you think it's so important for attendees to go to your session versus someone else's session happening at the same time?
I think one of the things that's going to make our session special is that we are planning to have a lot of hands-on experience. So we're going to have workshopping some exercise things. We're going to have workshopping some manual therapy stuff. We're going to have handouts to help you feel what axillary web syndrome feels like. So a lot of stuff that's going to be tactile. And yes, you can do that over video later, but it's going to be really nice to do that in person. And I think we're really trying to tie together the ortho as well as the onco. So trying to keep everyone really excited. And so being there with the two different disciplines will hopefully spark a lot of great conversation as well. So you can learn from people while you're there, not just us.
I agree. And Katie's so good with that hands-on stuff. I think that's the first year, like I said, when we met, I was like, oh my gosh, this is so great. We're not just standing up here talking, we're getting some hands-on, and, we'll be doing some standing up there talking, but we'll, just, and she has so many great ideas with that to engage. And, it's going to be engaging. It's not just going to, be sitting and listening. And again, I think just to clarify some of the side effects that we might see, and like you said, Katie, how that feels, what are we actually going to feel? And if I feel this, can I treat this, or should I refer them to, someone who is trained in lymphedema treatment, or, what I'm saying, or other areas, or neuro, again, all of those areas. So I think this is going to help clarify a lot of that.
Yeah.
I love that you say that, because that's one of the things we want to give to people is we want you to walk out of the session and have the confidence to say, oh, hey, in my clinic, send me the patients with breast cancer. Or we don't have a cancer center close to us that has rehab. Let's network with one.
That's a really good point too. And I think a lot of oncology rehab, there's, and understandably so, there's a lot of really wonderful oncology rehab programs that are really well established, that have been established for a while in big cities with, access to these big medical institutions, academic institutions. But there's also a lot of attendees who are coming to this who may be the only clinician in their clinic, their, hospital area, their community, who are willing and open to treating oncology patients. I'm here in Fort Worth, Texas. I talk about this all the time. And as big as Fort Worth, Texas is, like we're literally the 12th or 13th largest city in the United States, we have a desert of oncology rehab care available. And so a lot of patients are either driving across to Dallas, or sometimes they're just not getting it, which is really unfortunate. So for the clinician who, is in that position, like you're talking about, who is, they're kind of alone, they're kind of practicing by themselves, they don't have a lot of resources. What is something that they are going to take away from this presentation that's going to help them, not just learn this information, but also implement it when they get back to their clinic or hospital, what have you, on Monday after CSM?
I think if
I
it's
think
okay,
one of the things. Oh no, yeah.
Go ahead.
Oh no, you go first.
No, I was just going to say, I know in the beginning when we were introducing, I said I work for a large hospital system, but I work for a community-based system and always have. And so that, it's a large system, but where our clinic is a smaller. And so we're exactly that, like you said, Elise, we're that very, I hate to use the word fragmented, but I kind of, want to say that sometimes because like you said, they go to the larger academic centers for maybe their surgery and their, treatment planning, and maybe even their radiation, or maybe they do their radiation closer to us. And so it's not as if we are in that system where everyone comes in, to see everybody on one day. That's not the case. And so we have people from rural areas driving 2 hours to see us, and so again, like Katie said, this is why we need the other, we need everybody to be able to treat them for the, for everything. So
yes,
go ahead, Katie. I'm sorry.
Yeah.
Oh my gosh.
No, I think that's great. I think one of the things too that we've really tried to do is plan the session so that we sort of explain why we're there, explain about cancer, explain about breast cancer, go back through kind of the orthopedic manual and tie it to the shoulder, and then show you what a eval would look like, what treatment would look like, what tests you would use. And then that hands-on kind of experience that people are going to have, giving you the sense of, okay, I get this. And I'm really confident with frozen shoulder. And now I know that I can adapt it for radiation fibrosis or intercostal brachial neuralgia that I might not have thought about or caught. And so we hope to tie all those pieces together so that if you are in a clinic and you're alone, you kind of have an idea of what to do, where to go.
Yeah.
And I think, don't we always,
Paula, I don't love the word fragmented, but go ahead.
That's all right. I'm sorry. There might be a little delay there. I was just going to say, isn't that what we always say too, is that we want to kind of disseminate some of the ideas that, oh my goodness, this person had cancer. Should I touch them? Should I work with their shoulder if they had radiation? Or,
my gosh.
Don't we talk about that a lot? Yeah. So I feel like exactly like
definitely.
what you said, Katie.
That's such an excellent point, Paula, of, I think in oncology, we've done, like within oncology PT, oncology rehab, we've done a good job of kind of, we understand it is okay and it is very good for us to work with people who have cancer, even as they're going through cancer treatment, even as they have active cancer. I feel like we have an understanding of that. But that is not widespread knowledge. I think, and I use the we, like the royal we. We as a field have done a really good job of keeping that information to ourselves. Whether that was on purpose or accident doesn't matter. But we kind of tend to keep that to ourselves. And your session is doing a really good job of going into the ortho space, for example, with this presentation and really making those connections that, we talk about, we're comfortable with because we see these patients all day, every day. But again, it's very much like, I think a lot of times, like Katie was talking about at the beginning, there's this idea of, oh, that person has cancer, they need to go see Katie or they need to go see Paula. I can't see them because I don't know what to do with them. I'm going to hurt them. And, while well-intentioned, unfortunately, that is still the reality for a lot of clinicians. Whether that's we learn that in school or just we pick that up, as we work with patients of, oh, hands off, I can't touch them. They have cancer. They need to go see, a specialist, only an Onco-PT, for example.
Yeah, definitely. And we would, of course, love to treat all of them, but you can't. You just can't. There's just not
Right.
enough time during the day. And one of the things I've gotten to see in my hospital system is that showing this to the other therapists that I work with, and they'll email me and they'll say, "Oh, I have this patient, and they're coming in, and it's for their pre-eval for lymphedema. What do I do? Should they not use their arm?" You're like, no, no, no. Let me teach you. Let me show you. And then they do the eval, and they come back to you with another email, and they're like, that was easy. Okay, cool. I've got this patient. I'm like, yes. And that's what we want.
That's so true. And we have so much evidence, when I think about when I started this umpteen years ago, and that was what people were told. Don't use your arm, you might develop lymphedema. And now we have so much evidence talking about the benefits of exercise, reducing exacerbations and helping to control it. And that's just one thing. That's just lymphedema. You know what I mean? But as we know, with cancer-related fatigue, and we'll talk a little bit about some of that exercise guidelines and that sort of thing. So
love that. Oh my gosh. And again, we are so good at exercise prescription. Like, I feel like we do that all day, every day. And I love how structured those guidelines are. I think, giving those along with all of the information that you're giving in your presentation is really going to be freeing or, relieving for some of the clinicians in the audience to say, oh, you're right. I do have what it takes to work with these patients. I do have a lot of ortho skills that are very applicable here. So I think there's going to be a ton of takeaways that the audience is going to get from this presentation. But of all of those takeaways, what is one thing that you want attendees to take away from your session at CSM?
I think just having the confidence to say, yes, I can treat a patient with breast cancer. Yes, I can see someone with stage 0 lymphedema. Yes, I can know that if they're coming in and I can't piece it together from the ortho things that I've ruled out, maybe it's a cancer thing. And it could be that they're in treatment. It could be that they're 15 years out of treatment and they still can't deal with their shirt touching their skin. I can help them now.
I agree. I couldn't have said it better. And I think we've already touched on several of those things, that just to know that, because, if you see that diagnosis and you're like, oh no, they had cancer. Can I do this? Can I do that? You know what I mean? Yes, you can. And, you're going to make them better by doing what we do as PTs, right? That this is what we do. And like you said about exercise prescription, isn't that what we do? And so, so I totally agree with Katie. That is, I think, our biggest takeaway is just to kind of, and I think just having that little bit more understanding of the rehab implications and side effects of chemo, radiation, surgeries, just knowing, okay, well, maybe this is why they're having this issue. It's not just a normal frozen shoulder, right? They've had these other things. And yes, it's okay if I perform this type of manual therapy and that sort of thing.
Yep. I love that. So when does your CSM session take place?
Friday, Valentine's Day at 11 o'clock in the morning.
Oh my God.
So you
how
can
perfect.
love to treat patients with breast cancer.
Oh my God. It's perfect.
Oh, that's really good. That's so good.
Amazing. So in case you missed that, it is happening on Friday, Valentine's Day, which is so romantic to get to spend your, mid-morning with Katie and Paula talking about breast cancer and shoulder dysfunction. It is also available on demand. So if maybe you're not joining us in person for CSM, you can still get a lot of goodness from this presentation and implement it with your own patients in your own community. Last question here. If people want to connect with you and continue to learn more from you, how can they do that? Let's start with Katie.
You can find me on drkatiedpt.com, and you can send me an email, or drkatiedpt@gmail.com. Easy enough. And then check out all the past Onco-PT podcasts and learn more.
Can't wait. And you, Paula?
Love it. Yeah, do Paula Stout DPT at outlook.com. Email me anytime. I'm more than happy to help and or discuss these things, as you can tell. So, and again, listen to this podcast.
And I have to say, just quickly, hopefully they will come to our session. Lots of folks will come to our session, and they will love it, and they will want to learn more about patients with breast cancer and lymphedema, and they'll go to Paula's session about the Lymphedema Treatment Act.
And also Katie's other session on more. So
yes, come and rub your feet. Also, we'll teach you how to do the shoulder, and then I'll teach you how to do the feet.
Y'all, these PTs are on the map and taking over the world when it comes to oncology rehab. And it is the best thing ever. So like, if you can't get enough of them from this session alone, there are multiple other options for you to enjoy and learn from them. I'm personally very excited for both of them because Paula, as we've mentioned, is also doing a session on updates with, what's happened with the Lymphedema Treatment Act and how this is affecting, getting compression and whatnot for our patients, which I'm really excited about. And Katie is coming on the podcast in another episode, so I'm not going to spoil that too much right now because it's already planned. So I'm going to make Katie wait a little bit to talk about hers, but it does look like Katie has something else to say.
I do want to also put out there, because I know, Elise, you're so great at talking about what everyone does and what everyone specializes in. And I hope that everyone who gets excited about oncology PT also goes to Elise's session at CSM to learn more about why Onco-PT should be a hashtag.
It's true. And we will talk about that more shortly. Do not fret, my friend. Honestly, this CSM is probably one of the strongest when it comes to such a variety of oncology topics and speakers too. Like, this might be the best one yet. And I haven't gone yet. Obviously, it hasn't happened yet. But man, there are a lot of sessions that I'm really, really looking forward to. And I don't know how I'm going to pick which ones I'm going to, frankly. Like, I say this every year, but I mean this with all sincerity the most this year. I need one of those time turners to where I can go back in time and then just visit all of the sessions live, because I have the worst FOMO at CSM. It's awful.
Agreed. I know this is amazing. And I know that's been our goal, is to have different, and like, you look at it this year and you're like, wow, look at all of the different options. I'm excited too.
Amazing. Oh my gosh. Well, thank you so much, both of you, for coming on the podcast today and talking about your session. Remember, if you are looking for their session, it takes place on Friday, and it is from the 11 to 1 p.m. block, I think is what we said. Very, very good. And remember, it is not in the oncology programming section. It is in ortho. So ortho, OR 2118. My patient with breast cancer is your patient with shoulder dysfunction, combining Onco and Ortho-PT. Just one more time, make sure that you've got it, set aside in your app or bookmarked on your calendar, whatever you need. I will, of course, be linking to all of this information in the show notes. Once again, Katie, Paula, thank you so much for joining me today on the podcast. And until next time, this is Elise with the Onco-PT. And remember, you are exactly the physical therapist that your patients with cancer need. So let's get to work.
Thank you so much for listening to this episode of the Onco-PT podcast. If you'd like to help support the podcast, please share it with others, leave a rating and review, or support us on Patreon.